here for our focus for not only the Woven Basket this month, but our forums, the We Health Clinic. We Health Clinic is the area's only sexual, reproductive, gender-affirming, and abortion healthcare provider in the Northland area. We Health Clinic's Executive Director, Paulina Briggs, and Operations Director, Jordan Wigfall, will discuss the clinic's 40 years of care, its current offering of services, and the challenges and successes that the clinic and the greater reproductive freedom movement are facing. I know many of you were at the fundraiser a couple of weeks ago, and there's a special UU connection with the amazing work that Tina has done as the founder and the start of this clinic. Thank you, Kathy, perfect timing. And so
we weren't planning to make an entrance, but thank you.
That was perfectly timed. And so with that, we're going to learn all about the history. And Tina, you're welcome to contribute to that too. But I'll pass it to both of you here, Paulina and Jordan. Thank you.
Thank you. So yes, I am Paulina Briggs, Executive Director of We Health Clinic, and Jordan is our Operations Director. So a little bit of history about, well, first of all, I do want to say thank you so much for having us today and for choosing us to be recipients of the Woven Basket. We're so grateful for your support and for hosting our fundraiser. Recently, it was a really big success and everyone loved the space, so really appreciate the support that the church provides to our clinic. So We Health Clinic, its history can go back to September 1975 when the Midwest Health Center, which was an abortion clinic in the Twin Cities area, decided that another abortion provider was needed in greater Minnesota. At that time, 98% of abortions were performed in the Twin Cities. However, 55% of patients were from outside the metro area. So they really saw a great need for abortion providers outside of the Twin Cities, and they honed in on Duluth. And abortion at that time was really difficult for people to obtain, particularly for young, poor, and rural individuals that had to travel so far for care. And leaders at the Midwest Health Center saw that need for an abortion provider in Duluth, and their medical director at the time, Jane Hodgson, who, for those of you who don't know, is a really great Minnesotan. She was a founding fellow of the American College of Obstetrics and Gynecology. She was a really huge pioneer and champion in the abortion rights movement. And she spent most of her career in Minnesota, and before Roe versus Wade, she was the first doctor who was convicted of performing an abortion in a hospital. She didn't serve jail time, but her conviction and advocacy was instrumental in the legalization of abortion. And so her, along with the other leaders at the Midwest Health Center, decided to open up a Midwest Health Center Duluth, which was established in 1981 with Tina Welsh as its first executive director. At that time, no physicians local to Duluth were willing to provide abortions, so all doctors traveled from out of town due to privacy and safety concerns. And that continues to be a trend throughout the United States because of security threats that physicians providing abortions see. A lot of them end up traveling outside of where they live to go and provide care elsewhere. Midwest Health Center Duluth relied on grants and financial support. However, they became self-reliant based on just their operational income, and became independent from Midwest Health Center in 1983 and renamed itself Women's Health Center at that time. They were in the medical arts building. However, they were facing a lot of anti-abortion activity at that location. There was picketing, there was acts of violence and threats of violence. And so the landlord at that location eventually got kind of fed up and kicked us out. And so we lost our lease in 1990. And we moved to Arrowhead Place, but again, the anti-abortion people followed us there. The picketing continued. There was a butyric acid attack and gluing locks shut in an attempt to, prevent us from providing care. And again, those landlords at that location, once again, kicked us out. And so in 1993 is when that happened. And so at that time, the leaders at the clinic, including Tina, decided that the clinic really needed a safe, secure, permanent and intentional home for an abortion provider in Minnesota, in Duluth. So Tina Welsh, Rosemary Rocco of PAVSA, and Karen Diver of the YWCA Duluth came together and began a capital campaign to raise $3 million for the purchase and renovation of our current home, the Building for Women, which is in downtown on 1st Street and 1st Avenue East. And as the capital campaign to purchase the building was happening, the Catholic Diocese of Duluth was running a counter campaign, so there really was a lot of anti-activity at the time and trying to undermine efforts to raise money to secure this building. Despite that though, they achieved their goal and Women's Health Center was able to move into the building for women in December of 1993. In addition to us, it's also the home of PAVSA, the Program for Aid to Victims of Sexual Assault, and the YWCA, and the building was created as a place for nonprofits to have an affordable, accessible location, and it also serves as a community gathering space for other local groups. There's rooms for rent on the basement level for like meetings and community events. And then there's also some social justice demonstrations that happen outside the clinic or outside the building on our plaza as well. Just some legislative and legal highlights to talk about, historical ones and the ones that are currently happening in Minnesota as far as abortion care goes. Doe versus Gomez was a pivotal case here in Minnesota, and the Minnesota legislature was seeking to restrict access to abortion at that time by passing a statute that prohibited the use of medical assistance, which is the low-income insurance option here in Minnesota. So they were attempting to prohibit the use of medical assistance to pay for abortion. And Women's Health Center was a plaintiff in that 1995 case. The case made it all the way to the Minnesota Supreme Court, and the court ruled that our right to have and to decide to have an abortion is protected by the Minnesota Constitution. And that decision not only protected our rights to abortion, but also ensured that it is covered by our public insurance programs, which is actually pretty unique in the United States. Minnesota is one of only 16 states in the US where its state insurance covers abortion, so we're pretty lucky in that regard. There was, of course, the Dobbs versus Jackson decision, which happened in 2022, which I'm sure you all heard about. It was the decision that did overturn Roe versus Wade. And that was a case based out of Jackson, Mississippi, and the Supreme Court ruled in favor of the state of Mississippi, overturning the federal right to abortion and leaving it up to the states. And as a result, there is currently a patchwork of abortion access throughout the United States, with some states having pre-Roe bans that were kind of triggered and activated at the moment that that court decision passed. We've also seen gestational viability bans, meaning they're trying to, block access to abortion after a certain gestational age in pregnancy. Reason bans, meaning they only allow abortions for certain reasons. Method bans, meaning they're trying to ban medication abortion is a common one right now that you might have heard about. They're trying to ban the medications used in medication abortion. And then, there's just so many different efforts legislatively to undermine abortion access, whether it's through like insurance coverage, limits on funding to abortion clinics, et cetera, et cetera. So while that's happening in the United States, in Minnesota, we are actually kind of doing the opposite here, and we have really become an island of abortion access, and we currently have a trifecta of supportive legislature in the House and the Senate and our governor's office. And so just within the last couple of years, our elected officials have been able to do some really amazing things to protect abortion access in the state. Doe versus Minnesota was a case that happened in 2022 that removed some of the restrictions here in Minnesota and made it easier for patients to access abortion care and for us to provide abortion care. The PRO Act was passed in early 2023, and that further enshrined the right to abortion in our state constitution. And now with this legislative session and moving forward, our elected officials are really looking to support the infrastructure of abortion providers in the state. Minnesota has seen a 40% increase in the number of abortions performed since Roe versus Wade got overturned. And so that really has put a strain on our abortion providers. There's a lot of patients coming from out of state traveling to us. And at our clinic in Duluth, what we've seen is kind of this ripple effect where there's all of these out-of-state patients coming to the clinics in the Twin Cities. And so they end up having long wait times that could be weeks or even months out. And for a time-sensitive procedure like abortion, that's just unacceptable. And so those patients local to the Twin Cities are being forced to travel to us. So we are seeing a greater number of kind of interstate travel patients coming to our clinic. And so, the legislature is working on a number of, fronts with that. They're trying to increase insurance coverage for abortion. Most private insurances do not cover, actually I'd say the vast majority of them do not cover abortion care, and so they're working to create a requirement where private health insurance does have to cover abortion. They're also looking to providing direct funding for abortion providers. And then one big issue is, like I said earlier, medical assistance in Minnesota does cover the cost of abortion, which is great for patients. However, the reimbursement rate that we receive from the state for each of those medical assisted patients is really minimal. I'm talking like a fraction of what it actually costs to provide an abortion. So at our clinic, it costs $700, and the reimbursement that we receive from the state is $240. And about 50% of our patients are low-income medical assistance users. And so for every one of those patients we see, we are facing a significant net loss. As far as the more recent happenings at the clinic, like I said, we used to be called Women's Health Center, which served us really well for a long time. But in 2019, we changed our name to We Health Clinic to better reflect our services and the patients that we serve. We've always served men, women, everyone in between. And we also provide gender-affirming hormone care to trans and non-binary individuals. Our other services also include STI testing, birth control, miscarriage management, pap smears, cervical exams, contraceptives, general gynecological care. So we changed our name to better fit all of the patients that we serve. Another recent change is Jordan and I took over as executive director. After Tina Welsh, there was Lori Casey, who served the clinic since 2008, and then last year Jordan and I took over in the transition.
Yeah.
I'll let Jordan talk about that.
Yes, and we've added a local nurse practitioner to our roster of doctors and medical staff. We are transitioning to an EMR, which is an electronic medical records, which we've been paper charts for the entirety of our entire existence. So we are transitioning into an EMR starting hopefully this summer. We have a beautiful sign outside of our building that jets up from the building that show that when you're coming down our street, you can better see our building, which is really nice because lots of our patients will get us confused with the Crisis Pregnancy Center that's kitty corner from us that had a very similar name to us at the beginning. They're called the Women's Care Center, and we used to be called Women's Health Center. So yeah, it's a better way for our patients to be able to find us and things like that. We are now implementing, starting this month, advanced provision with medication abortion. So any patient that is coming into our clinic for abortion care this month, we are kind of doing like a soft launch and asking them if they would potentially like advanced provision with medication abortion, and all it is giving them the medication abortion pills for a later pregnancy that they would not have to then come back to our clinic and have an entire appointment. They would have that medication to be able to use at their convenience throughout the year. Some different things, some services that we, just some breakdown of some services that we have Paulina already talked a lot about, like our hormone therapy. We do emergency contraceptive, ultrasounds, pregnancy testing, and options counseling, miscarriage management, all kinds of STI testing, contraceptives, including IUDs and implants. We do telehealth services. We help patients get signed up with insurance. Paulina is the lead navigator to help with our clinic. We do follow-up support for patients who have had abortions at our clinic and choose to manage their abortions in different areas. So we're just usually here to help any kind of patient that really needs us. Some of our abortion numbers for 2023, we had 528 abortions at our clinic, 207 were suction, 167 were medicals, and 154 were telehealth medication abortions. Our telehealth medication abortions have definitely risen in the last couple of years, which is great because it just makes it way more accessible for patients to have their abortions at their convenience. For family planning patients, which is any of our GYN patients, is 260 patients we've seen last year. Our gender-affirming patients, we had 50. STI testing, we had 492. MNsure enrollment, so anybody getting signed up with insurance, was 21. We dispense 449 different EC units dispensed, and that's for any of our outreach programs that we had, and emergency contraceptive, thank you, at our clinic. We had 64 LARCs, which is different kinds of birth control, the implant, and IUDs. Total unduplicated patients, we had 804, and total patient visits, we had 1,376 last year. So we've seen a vast majority of patients. Some anti-activities that we have been dealing with is our persistent anti-abortion presence outside of our clinic each week. We have groups of about 3 to 15 people that will stand outside of our clinic and harass patients and our escorts that are out there. We have a great volunteer escort program that our event and program coordinator has developed and kept steady, and we have high numbers of volunteers that help outside of our clinic, which is amazing. Some of the things that the anti-abortion groups that are doing to kind of not deter us, but to make it difficult for us to provide care is calling the police more often outside of our clinic. So they'll call the police saying that like one of our volunteers blocked them from something, and then the police come and it just kind of disrupts our day. Putting their bodies between the escorts and the patients, trying to get into patient vehicles, following patients more than a block away down the street, lying to patients about what they can and cannot do inside of our clinic, telling them, like that you can't view your ultrasound, or, that they'll keep you there and things like that, which is completely untrue. Patients are allowed to leave whenever they want at our clinic. Some information about CPCs, which is Crisis Pregnancy Centers. We have one right across the street from us, which is the Women's Care Center. They tell patients lies about, like they have to have an appointment with them before they can actually come to our clinic and have an abortion, which is completely untrue. They also tell patients that you have to look at your ultrasound, or that you have to have an ultrasound before you make an abortion appointment, which is very untrue. Not telling patients about their pregnancy options, underestimating their pregnancy dating, so telling them they're farther along or telling them they're less farther along, and making it hard for patients to be able to get care the way that they should.
Just to let you know, the clinic is a nonprofit, so our funding sources to support our work, while we are a clinic, we do accept payment from patients.
Be still with us too. Thank you.
Yeah. Payments from patients or insurances, but we also do rely really heavily on grant funding and donations and support, like the ones that we're going to be receiving from you this month. So again, thank you so much. Some of the financial challenges that the clinic continues to face, like I kind of mentioned earlier, the Affordable Care Act actually explicitly prohibits states from including abortion in any essential benefits package. So that's something that the Minnesota State Legislature is working on improving, is making private insurance throughout the state cover abortion, because so many of our patients have insurance, but it just doesn't cover it, so they have to pay out of pocket or take out a credit card, ask friends and family for funding, and that is just not sustainable, and it doesn't make any sense because abortion is an essential preventative healthcare service. Like I said, the medical assistance rate, despite covering abortion, which is nice for patients, the reimbursement that we receive back is just a fraction of the costs that we need. But despite that, we don't cap the number of medical assistance patients that we see. That is an option for doctors' offices, but we feel like it's really integral to our mission to not cap the number of low-income medical assistance patients we see. So again, thank you for your support. It really means a lot to us. I think my papers were out of order here. Oh no, I'm all done. Okay.
Yep.
Any questions at all? Yes.
Excellent. Just wait, before we start Q&A, just a big round of applause. Thank you. And then for our online attendees, starting with both of you, I'm just going to get this squared away so that they can see you both as well. And then we'll have the microphone so people can hear online here too. Thank you, Ann.
What is telehealth?
So that means that a patient doesn't have to come into the clinic physically themselves. They are able to fill out forms online, and then they have like a video chat with the doctor, and then we mail the medications to their home. So that just makes abortion, and also some of our other services like birth control, we also offer that way. So it just makes it a lot more accessible for people. And like I said, especially with the interstate travel that's been happening with abortion, it just helps open up our services to greater Minnesota for a lot of people.
This is a comment from one of our online attendees, Katie. Thank you for doing this work. I've been patient escorting at We Health on and off for the last 3 years, and have seen how awful the anti-protesters are to the patients. I don't usually hear much of what goes on at the clinic when I escort, so it's great to hear more of what is going on behind the scenes. All right, Beth, go for it.
With extended family, I'm more familiar with doing the medication abortion in the doctor's office, but when you do it by telehealth, is that an appointment when they're taking, because there's the 2 stages, it's 2 steps in, or how, if people get cramps or uncomfortable, how do they have an access to you then, or how does that work out?
Yeah, so we, with all of our patients, we prepare them as much as we can for what the experience of having an abortion is going to look like. So education is a really big part of it, preparing them and letting them know what's normal or when to call us. And we do have a 24-hour staff call line, so they can get connected with a staff member at any time if they have any questions or problems.
Who else has that guy? Louise?
Good morning, thank you for being here. You may have answered this already since I came in late, I may have missed it, but could you explain what the training process is for escorts, volunteers, and what kind of time commitment both the training and the position of an escort can be?
Yeah, so we have a variety of volunteer opportunities at our clinic. You can find them on our website. But yeah, there's clinic escorting, and we do, I think it's every other month, trainings for clinic escorts. That's just like a Zoom, so it's just a one-night training, and then we ask our escorts to come once a month at least. And so we provide abortions 1 day a week at our clinic. It's usually either Thursdays or Fridays, and we want our clinic escorts to be there in the morning when patients are arriving. So it's usually like a 4-hour shift. And there is just that online training ahead of time, and then you kind of get on the site training as you're starting out as well. And like I said, it's like a once a month commitment, a 4-hour shift. And then our other volunteer opportunities, we have a volunteer group that meets monthly at our clinic and just works at projects around the clinic. So that's a great way to help out as well. And then we also have recently started accepting more long-term volunteer opportunities. So we have a front office volunteer person who helps us, make copies and check in patients, and then we also have a volunteer who is in kind of the medical side of things and helps us on abortion days with cleaning instruments and cleaning rooms and helping bring patients to their rooms.
Well, I arrived kind of late, but I was wondering, do you serve a lot of other patients from out of state since abortions were banned?
We do. We've always served a lot of out-of-state patients because we've always been the only abortion provider for hundreds of miles in any direction. So our service area has always included northern Wisconsin and the UP of Michigan. So that didn't really change even with the overturning of Roe versus Wade because they never had very good abortion access in those areas. But we have seen an increase in out-of-state patients coming from more like southern Wisconsin, as well as a few from like North Dakota, South Dakota, and Iowa as well.
I wonder if you could tell me what relationship you might have with, or interaction you have with the Duluth hospitals. And also, are there any obstetricians or other physicians in the community that would provide abortions if they were requested, or how does that work?
Yeah. So we have a pretty good relationship with the hospitals in town. Our medical director is Judith Johnson, who was an OBGYN at St. Luke's for a long time, so we have really good connections with St. Luke's. Essentially is a Catholic organization, so historically there have been some issues when we've transferred patients there or referred them there for care. They just kind of create more hassle than needs to happen. So we try to refer patients more often to St. Luke's. However, I will say Essentia has been getting better, and it is really individual by provider. Some providers are much better than others. And historically at hospitals, they don't provide a lot of abortions. They may make exceptions for fetal anomalies or in cases where the mother's health is really at risk. But that is, first of all, a lot more work because sometimes, depending on the hospital, depending on the case, the ethics board has to meet and kind of approve of that in a lot of cases, and then it's also much more expensive to receive an abortion at a hospital than at our clinic. Just the nature of going to a hospital, it's just so much more expensive than coming to our clinic where it's a simple outpatient procedure, and we've been doing it for 40 years, so we've gotten really efficient at it, and we try to keep our costs as low as possible, and work with abortion funds, which are nonprofit organizations that help raise money to directly fund patients' abortions. And so about, 30% of our patients access those funds, and a lot of the time patients are able to get a significant portion of their care covered, if not all of it, and hospitals just don't have that same kind of connection or the resources available to help patients financially in that way.
We've also been able to develop a better relationship with the hospitals. We've actually in the last year had multiple different nurses and doctors that have called our clinic to ask questions about our abortion care services so that they can relay it to their patients. So it seems like Essentia Health is changing a little bit, which is definitely for the better.
Alright, this is a fun one from online. You are my wee rose. So glad to learn more. When did you begin offering gender-affirming care, and is there a minimum age requirement?
We began offering it in 2019, and we don't provide gender-affirming care to minors, so you do have to be 18 or older. I do know that Duluth Family Medicine, I believe, offers gender-affirming care to minors. I think Essentia might as well, but I'm not sure on that. But I know for sure Duluth Family Medicine offers it to minors.
Good morning, thank you for being here. I'm Tom Angland. I work at Essentia, and I'm a chaplain there actually. And my understanding is that Essentia as a whole is not a Catholic organization, but that St. Mary's is a Catholic hospital and has been. My understanding also is that Essentia Health Duluth, also called Willard Dwan, is not a Catholic organization. And I don't know where that kind of care would happen in the hospital, but you probably are already aware of that. The question I have for you is, it would seem to me that people coming to you for services, no matter any of the services that you offer, might often benefit from support. I hesitate to say spiritual care because that has connotations of being religious, even though as a chaplain we meet anyone where they are. I don't identify as Christian, for example, but I'm just wondering if that is something that you have provided or tried to provide or tried to find community partners for.
Yeah, and on your first point, Essentia, like I said, it's just, there's just been issues, and I don't know, and it has been getting better. And it was an issue of sometimes some areas of the hospital, I think, maybe you could speak on it more because you used to work at Essentia, but like the OR used to be in one area and then OBGYN used to be in another, and like OBGYN was okay, but if that patient needed to be transferred to the OR, that's when the hassle started happening. I don't know,
So how it worked at the hospital was, like, especially if you wanted to, like, for instance, have your tubes tied after you had a baby, you had to have your baby over at Millard Dwan, could not actually have your baby in the hospital because at the time, as a Catholic hospital, that was not something they allowed in the hospital, was to have your tubes tied in the hospital. So you had to do that at Millard Dwan and then be wheeled back over to the main hospital. With the new hospital, though, that is no longer the case, which is absolutely amazing for Essentia Health that they no longer have to do that. That is one thing that is a benefit from that. And I know that just because we have a few different of our nurses that work at Essentia, so they give us a little bit of insight of what's happening at the hospital and what is okay now and what is not okay. I know that they have been getting a little bit better about abortion care and have been a little bit better about talking to their patients about all of their options and things like that. And one of the doctors at Essentia we have a little bit better of a relationship with. She has been able to answer a lot more questions for our main doctor about what is allowed at Essentia and what can be helpful and what is not helpful. So that's really nice.
Yeah, and then to your second point, if patients express any kind of issues that they're having spiritually, emotionally, mentally, during, before, or after their abortion, we do offer them resources. There's this organization called Faith Aloud. I don't know if you've heard of that, but they offer remote spiritual guidance and counseling to patients. So they have abortion patients. So they have multiple faith leaders from different faiths. So we offer that to patients if they need that kind of support. And they're a really great organization.
Great to know, thank you. I see Ann's hand first, then go for it. Well,
I'm wondering if you have any insight into what's happening in the states that have banned abortion, on the alternatives in that state that are helping to let us come back to having abortions.
Yeah, so following the fall of Roe, Minnesota was surrounded by states that enacted some kind of a restriction or ban on abortion. Recently, last year, Wisconsin rescinded that, and abortion care has resumed in Wisconsin. But yeah, it's been really heartbreaking to see so many clinics close, and the stories that are coming out of these states are really scary and heartbreaking. There are online organizations where you can get medication abortion. The legality of that is kind of questionable, so patients need to know that they are taking on a legal risk in accessing that care. But it is out there, and it is pretty easy to get medication abortions mailed to you. There's international organizations that are shipping medication abortions to people. But of course, that doesn't help people that are too far along in their pregnancy and can have a medication abortion or might have any other coexisting conditions that might prevent them from having a medication abortion. So there are a lot of people that are being forced to travel very far, which is not accessible for a lot of people to take, a multi-day trip to go and access medical care. But those abortion funds that I was talking about earlier that help people pay for the cost of their abortion, they can also help pay for travel and lodging costs. So there are a lot of people trying really hard to help people access the care that they need, but it is really, really difficult, and there certainly are a lot of people getting left behind.
My wife Sally makes me watch the show, Call the Midwife. Anybody watch that? Anyway, I'm becoming an expert at giving deliveries. But do you have as many problems at the clinic as they have on that show?
Not as many, no.
Yeah, no, abortion is very, very safe. And it's safer than getting the colonoscopy. It's 21 times safer than giving birth. So complication rates are very rare. And yeah.
I just wanted to put a plug in for being a guide. I know I'm guessing you would prefer guides that would sign up every month for time, but I did training as a guide, and that means I get invited to their events and their special kinds of things, because you can't just show up at the clinic unless you've gone through training, because there's a lot of people who might pretend to be helpers that really are not. So the shift that I did take, it was so cold out, and you guys were awesome. I had, frost on my eyelashes. And let me tell you, the people who are there for other efforts, they don't, they're worse on cold days, right? I mean, there's a lot more of them. So going through the training is pretty harmless. It does take some time, but even if you can't make the monthly commitment, is that okay to say?
Yeah.
That you wouldn't mind that more people are trained in as guides because you have more helpers out there for the other events?
Yeah, no harm in taking the training if you want, but we do ask for a monthly commitment if you are going to be an active clinic escort. And I won't say that it's not for everyone, because you do have to be outside first of all, which is hard to live sometimes, and also it is pretty draining. Like the anti-abortion people are pretty ruthless and relentless and mean, and it's hard to see patients having to face that. And so it takes a special kind of person, and we really appreciate our volunteers so much. And we try to, make it a nice time for them and let them take breaks and give them snacks and coffee and stuff. So we really appreciate it. We try to show our appreciation, but it's not an easy job. I do see, I have a question online that I'm gonna answer. How does We Health Clinic collaborate with, I'm assuming you mean Planned Parenthood? Planned Parenthood in Duluth does not provide abortions, which is intentional, because We Health Clinic was here first. And so Planned Parenthood was kind enough to, communicate with us that they were gonna open a location here, and, they didn't wanna take our patients away from us and put us at risk. So we really appreciate that from them. And then besides that, we refer patients back and forth to each other. Planned Parenthood has gotten better about that lately. Planned Parenthood is a large national organization, and for a long time they didn't collaborate super well with other providers, and so for a while they wouldn't tell patients that we were here, and they would instead send them to their location in St. Paul, which provided abortion, which why? But that's changed in the last like 5 years. Actually, one of our previous employees is now the manager there, so she certainly had something to do with that. But yeah, no, I mean, we're at community events together, and we provide a lot of the same services. Yeah, I don't know, Planned Parenthood is pretty good. I'd say sometimes we have more funding options for patients, especially with our reproductive and sexual health services, compared to Planned Parenthood. But we both do, good things, and Planned Parenthood, especially like legislatively, is at the forefront in a lot of states, which is great. And here in the state of Minnesota, we're a part of a network of abortion providers that work with elected officials and let them know what abortion providers need. And so we're a part of that team together when we meet with those elected officials.
I'm Ron Anderson, and I'm here partially because my wife was very instrumental in getting your hospital set it up because of the organization that she was in. Now, is that about 10 years ago that you started out?
Our clinic?
And when they got the hospital set up, was it 10 or 15 years ago?
It was longer than that, what was it?
I don't know, it's long, anyway.
1981, but yeah.
Anyway, I'm glad you guys are doing well. She would be she's not with me anymore, but she would be proud of what you're doing.
Thank you.
Yeah, Barb was a board member for many years and very supportive of what was then called the Women's Health Center. So I have, you kind of opened the door a little bit, so in terms of political activity and local elected officials that are supportive of choice and that aren't. We have some election coming up in the legislative session, and I'm pretty sure at least one now has an opponent that is pro-choice, and she's not pro-choice. And can you talk a little about how important it is to have pro-choice elected officials at all levels? Does it make a difference?
It makes a huge difference, and especially like I was saying earlier, we're so lucky to have a trifecta of pro-choice state, house, and governor's office. Jen McEwen is a huge champion for abortion. She, was a co-author on the PRO Act that enshrined the right to abortion in our Constitution in Minnesota, and they made that the first bill in the legislative session. So she really pushed to let Minnesotans and the whole country know that this is a really important issue for us. Jen Schultz, she's running again, or she's not.
Well, for Congress.
Yeah, for Congress, and yeah, she when she was in office and continues to be out of office, a huge supporter of abortion access as well.
Natalie Zalesnikar.
Yeah.
What about her?
I don't know a lot about her.
She's pretty anti-choice, and she's got a pro-choice. In fact, the Munger's relative is running against her. This is an example of me asking a question I knew the answer to. Okay, it's all right.
So yeah, it is incredibly important to vote. Support elected officials.
Unless somebody else has something. Seems like we got extra time here. So I just thought I would, so I'm married to Tina, who was the founder of the Women's Health Center here. Thank you, Tina. Good call out to you. And I think it's very interesting that after the overturn of Roe v. Wade, so for a long time, when Tina would go out in public, with the exception of this church, she would never say what her job was, because that was kind of how it was. And our house got picketed. There was one time that someone else parked in her parking space at the clinic, and when they were driving over the bridge to Superior, somebody had loosened all their hubcaps, and so their wheels came off. She had to wear a bulletproof vest to work. A number of hers, and the abortion, especially not just the nonprofit, but the abortion providers in the country were really a pretty close-knit group, and Tina was very active nationally with the National Abortion Federation. And as a result of this, a number of her friends were murdered. I mean, she knew George Tiller, who was killed in his church. He was a provider. So, and as I said, our house got picketed. So I think that people, so anyways, after Roe v. Wade, people are coming out of the woodwork, and they're calling her up, and they're thanking her for all her work. But all those years when she was out sort of in the clinic, used to when they had a fundraiser, it was kind of a secret where it was. And then kind of the crowning glory was when Tina retires in 2008, and we have a huge party for her down at the deck, and was also, of course, a fundraiser. A great event, and it's picketed. These picketers are down there. And Bonnie and Ferris Keeling go to this church, come in, and they have volunteered at the clinic as escorts, and you can't be, getting into it with the protesters at the clinic. But Bonnie came in and she said, well, this wasn't at the clinic, so I gave them a piece of my mind.
Good stories. Any other stories too, not just questions?
Yeah, I will say it is, it's incredible how the discussion around abortion has shifted within the last 2 years since Roe versus Wade got overturned, but even in the last 5, 7, 10 years, abortion isn't a bad word anymore. And especially in our clinic, we really try to say the word abortion because it's normal, it's a medical procedure, it's safe, and it's vital health care. And so, as a clinic, we want to be responsive to that, and we want to, take advantage of the fact that polls show that the majority of Americans support abortion and do not support any kind of restrictions or the government inserting itself in people's healthcare choices. And so, yeah, we've been able as a clinic to be more public in the last 5 years than we ever have been, and now, we post our events on Facebook, and we invite the public to these events, and we, the outpouring of support that we saw since the fall of Roe was really incredible. And so Duluth really let us know that they value us here in the community, and so that was really reassuring. And it's just been great to see.
Yes, I have a story that I wanted to share. Joan Drury was a very wealthy woman here in Duluth, and she donated money to the building for women a lot. And when she saw protesters outside, she would go outside and say, for every protester that's here, I'm gonna give $100. And she did that, so she was really a great person.
I can tell you all a story that the manager actually at Pizza Luce, who is, which is right down the street from us, that's right across the alley from us in the big building, they actually are super supportive of our clinic. And in the last year we had, when 40 Days of Life was going on, there were many, protesters outside of our clinic and things like that. And one of them actually called and asked the manager if she provided pizzas to women that were getting abortions. And she was so angry about that she called us and gave us pizza for the day. So it backfired on them that they called and said that. So yes, they've been a big supporter of our clinic. They have donated pizzas in the past and things like that. So that is one thing that I just wanted to share with all of you.
Great, yeah, jazz hands to that. All right, go for it, Louise.
Okay, this question, you may not feel able to answer this question, or Kathy may feel like she's the one to answer this question. Moving up to the overturning of Roe versus Wade, I remember reading and afterwards that maybe in the bigger picture, it was a good thing that Roe v. Wade was being overturned because, in fact, it would be better long-term for abortion access and rights if this were a state-by-state decision. So there are some arguments for that. And without going into too much detail about the reasoning behind those arguments, in your perspectives right now, are you able to provide some thought on that sort of question? Or maybe Kathy's able to say something like, yeah.
I'll never say that the overturning of Roe v. Wade was, I think maybe it might be a net positive. It's hard to say. Roe was always shaky, and it was always on this basis of the right to privacy. So it was always this kind of weird legal, justification anyways that didn't really get to the point. And I mean, as we saw, a Supreme Court decision isn't the most protective measure anyways, and so a better longer-term solution would be, I think that there should be a national right to abortion. I don't think that it should be in the form of a court decision, as we saw, that isn't, very, protective, yeah. So a constitutional right to abortion would be great. But Roe was never adequate anyways because it just guaranteed the right to abortion, but then immediately after that decision passed, groups were chipping away at that. So they were, forcing clinics to have certain physical size dimensions and, creating these 24-hour laws where women had to be provided information by the state before they could receive their abortion. They consistently kept chipping away at the actual right to abortion. So while in writing, people had the right to abortion, that wasn't always followed through. That being said though, we certainly, it has brought so much attention to the issue of abortion, and we've seen almost every single ballot measure that has been brought in regards to abortion since that has passed in favor of abortion rights. And so the voters have demonstrated over and over and over again that they support abortion access. And people are talking about this upcoming election and how abortion is such a top line important item for voters, and that might backfire in the Republicans' faces this coming election, which I think probably will happen in some aspects. But it's also hard to think about the net positive of it while at the same time seeing the actual reality of how this is killing people and affecting their ability to choose access healthcare and choose their life path and what their family looks like.
Thank you,
Yeah.
I think we're just about out of time. I'm gonna give it back to Brett.
Yeah, so at this point, thank you all so much for being here and your support again. For this month, our Woven Basket recipient is We Health Clinic, so please give generously. A big round of applause again to both Paulina and George for being here today. I'm sure if there's any other questions, you're welcome to come up after this when we kind of formally end. And come back next week because I believe we have the Duluth Art Institute for our guest for the forums. So we'd love to see you then. And again, thank you all for being here today, online and in person. Thank you, everyone.
Thank you.